restoration specialist in Newport Beach, California. I'm going to go through this case, but mostly I'm just using it as a backdrop to talk a little bit about how skin affects mental health. I had a lot of people that were coming to me over the last week, and it was really clear that they were suffering from their acne, from their scars for a really, really long time. And I think it's really, it's a topic that I've touched on a few times over here, but, from the chats and that I've had with patients and kind of like when I'm listening to you guys on here, you can see a lot of people have really suffered from issues with their skin, not necessarily just with acne, not just with scars, but sometimes with pigmentation as well. And it's worth looking into. It's worth looking into seeing how we can help, but it's also worth looking at how there's a wider community of people than you may expect that are also suffering from this. And it's interesting because everybody sort of thinks that they're like isolated, they're alone, but I see so many people over and over and over again. And then on this platform as well, and on the multiple different platforms, I see them, and it's it's not nearly as isolating as you may think. It turns out that there's a lot of people that also feel the same way, that have the same sort of insecurities that you have, the same kind of concern that you have. And it's nice that we have a community really to express that and think about that and talk about it, because it does cross really all socioeconomic divides. It also crosses all like racial barriers as well. And it's it doesn't matter if you're rich or poor. At some point, you may have suffered from something that was affecting your self-esteem with the way your appearance was. But what is a little bit frustrating for a lot of people is that it seems to be that treatments that could fix those issues could be really out of reach for you. And that's unfortunate for a lot of people, because it could really add to the mental health issues that people already have with their scars. Today, one of my patients, she came all the way from New Jersey. Her and her sister both came, and she was telling me that she started having her acne, really severe cystic acne, by the time she was 10 years old. You heard from Ziamora the other day that she was saying that when she was 8 years old, she started having acne, like severe cystic acne as a little kid. And it's tough for a lot of people at any age. And then think about like a child, like 8, 10 years old, and a lot of people will say that they were bullied. They were called names because of their acne. And then later on, they end up getting these scars, and it's like this reminder of that trauma, of the fact that they suffer from bullying, suffer from people picking on them. And it's tough. A lot of patients will say that same thing. This particular patient that I'm showcasing over, he had very severe scars. I worked on, in his case, it was a few different steps. What I did with him initially was I did a subcision. In some areas, I had to do talar liberator subcision for the upper part of the cheek there. For some of those spots, I did a little bit of something called Nokor needle. I used that for some other localized areas that were there, that were pulled down and stuck. I did that also along the jawline. I didn't use talar liberator along the jawline. I never really used that along the jawline. I used mostly blend cannula, and then here and there for some select spots, I'll use a bit of a needle. But I also did ablative CO2 laser for like those thick parts of the scar. So you can see where there's a bit of tissue contraction also, like the skin does look a little bit tighter, especially along the neck area. And that's because we ended up doing a bit of that where we use a CO2 laser to get some contraction there. And then we also have done some Bellafill for him. Through the laser channel holes, I put a dilute form of Sculptra in his case to really stimulate more collagen production as well. So a few different steps for him, TCA Cross for those ice picks and boxcar scars. So you can see really we did one bigger combination session, and then we did a few rounds of Bellafill, and it improved him a lot, a ton. There's still work to be done. I know that we still have to work on his neck area, for example. He doesn't have the downtime for something like a Phenol peel, for example, but it may end up changing, especially as it's getting softer and softer, the scars are rising, there's less thickness around the edges of the scar. I think we'll continue to improve it just with the laser and just keep on working on it. And as long as he's happy with it, that level, he says that his neck areas don't bother him as much as more of his face, like his cheek area, which has improved a ton. So yeah, we could get that there. But I do think there's more work to be done, especially around that neck area. It's just the neck, you can't like use as much heat, as much energy. You can't do the subcision the same way you do for like the upper part of the face. So it's an area that may take a little bit more work, take a little bit longer to improve. The other problem with the neck is that it's an area that's really mobile. And I always mention and talk about this a lot, that areas where it's mobile, you may end up feeling that it takes longer to develop that collagen response, because sometimes what ends up happening is that there's more tension on the scar as it's healing. And so you may end up actually feeling like that takes a little bit longer for you. So areas like around the nasolabial fold could take a little bit longer. Around the neck area, especially right in this pocket, that's an area that could really take a little bit longer for you to improve. Let's see here. Andres is saying, I only have a couple of these, but I want them gone. What do you suggest? It's tough to say. I mean, if they're like these kind of thicker scars, really you do need still, I typically would need something to resurface that. So usually you want to do something with a laser, and that's probably going to be the best option really for those kind of scars. How long is erbium downtime? Well, it depends. You kind of have to tell me how much downtime you have. Usually I would try to say in the first session, give me about 4 to 7 days. But subsequent sessions, we really could do about 2 to 4 days sometimes, depending on how you do with scars, how you do with lasers, I should say, how fast you respond. Those type of things really factor into it. So if you are somebody who's really, really good with sun exposure and we're able to do the laser again, then we can just kind of fine tune it to basically your lifestyle. If you can't take too much time off, it may take a few more sessions, but we could do it that way. And do you recommend Phenol peels even after acne scar sessions? Yeah, we could. So for example, we could sometimes make it softer, more superficial, and now it's less risky. I don't have to use a very high concentration of the Phenol perhaps. And it's possible that now that's the time now that it's going to be better for us, especially for Fitzpatrick, for patients really. And really maybe if somebody is really, really good about sun exposure, potentially like a Fitzpatrick 5, but it's really nice to be able to lift up that scar tissue so that way we could do it a little safer. So yeah, that is possible to do it that way. Is it possible to have a combination of rolling, ice pick, and boxcar scars? Yeah, definitely. In fact, a lot of people will have it that way. A lot of people will have this combination. Sometimes it will end up being that the boxcar scar turns into that rolling scar. Sometimes it's like there's a few different kinds of scars right next to this type of the scars, and then it ends up kind of like blending in together. You may see like a boxcar scar with a ice pick scar, and then it ended up kind of like just like connecting. So yeah, there's no way of like stopping where your acne lesion is and where sometimes where your fat loss occurs. So there's absolutely possible. Is it possible to get rid of scars without laser? There's some patients I don't use laser. It's true. It depends on how thick the edges of the scars are, what we're trying to achieve with it. So yes, it is possible to improve scars without laser. If that's something we have to do, we will do it that way. Especially for patients who are darker Fitzpatrick, like Fitzpatrick 6. Sometimes I don't use lasers at all. We may end up doing more with like subcision. We may do things for a TCA Cross, some volume, and then picking up that pigmentation actually works really well. So a lot of times there is hyperpigmentation in darker skin types. And then if you remove a lot of that pigmentation with something like the Pico laser, for example, you can get like really, it gets pretty close to just that fully ablative laser over time. So it's really may not even be necessary for a lot of patients. Is microdermabrasion or laser better for acne scars? What would you recommend? Well, microdermabrasion is totally in a different category. It's not even anywhere close to what we could do for scars. But dermabrasion is different. So the dermabrasion is really where we're using basically sandpaper on the skin, and we're smoothing down the scars that way. There's some people you may see they use like this this motorized device to actually smooth it down, something like a Dremel or something like that. But that's, I think, is a lot riskier for the vast majority of patients that are darker skin type. You could end up causing more hypopigmentation that way. So dermabrasion and laser are probably a similar category, but microdermabrasion, it's not even like in the same conversation at all. How do I tell if the scar is shallow? Most of mine are only visible under angled lighting. That's probably then means that it's shallow. There's probably not as much fat loss with it too, which is really good. So those are things that we could pretty much pick up really well with a little bit of TCA Cross and laser probably. Does microneedling work well for mild ice pick scars? Well, mild ice pick scars, I would say would be would still be the best thing will probably be a little bit of TCA. Just go tiny little bits of TCA in there. You still have to do like subsequent sessions of that, but that's probably going to be better than something like microneedling because that could actually make the scar appear a little bit wider. So wouldn't really recommend that. My Orlando is saying my dermatologist recommended 6 microneedling sessions, but I don't see any results. That's the thing. That's exactly what I'm referring to. It's really pretty mild, hardly effective for the vast majority of scars. And if you look at and ask the people, when do they get these results? How long, were these photos taken? It's like 1 week later, 2 weeks later. And almost anybody could tell you that's ever done microneedling or done lasers before that it's pretty, there's a lot of swelling for that first week or so. It looks great, but then it does go down really quickly. So, not something I would recommend for the vast majority of scars. Sorry, it does seem like there's a bit of a lag. I didn't want to restart it, but if you guys are getting that lag on my end, or on your end, let me know. So then I may just have to reset the whole thing. Let me know. Is cortisone injection for keloid on face safe while on Accutane? Yeah, I mean, you would definitely want to go to somebody who's conservative while doing it, but yes, it is okay to do it that way. It's just really about making sure that you're doing the right depth when they're doing the cortisone shot, that they also are making sure that they're not using a high concentration of the cortisone injection too. So a few different things like that. Sonia is saying, I booked with you, so excited. How long after consult can I book the procedure? Actually, some of my patients today, what they did was, or I should say one of my patients today did something where he booked the procedure already, and then he did a consultation at some point because he needed a certain time slot. So what he did was he actually booked the procedure, put a deposit down. He pretty much knew, a rough estimate of what he would need anyways, and basically so he locked up the time, and then he ended up doing the consultation for me today, but he apparently booked it like a couple months ago or so. And so that way he was already locked up on the books for the schedule and at some point in a couple months, which is probably a good idea. You could maybe consider doing it that way. You could actually just put a deposit down. Our prices are on our website, so you have a good idea for that. And you can just put a deposit down. But typically, it will take about 2 to 4 weeks after we do the consultation for us to prep the skin anyways. And then it's just a matter of like our schedule to see when we can fit you in though for those type of things. What about PIE scars? What's the fastest way to get rid of them? The thing is that it's actually probably you can't get rid of it too fast. That's actually the thing. It's actually you can't get rid of it too fast. It does actually take a while, especially in certain skin types. You may end up causing more hyperpigmentation if you try to rush it. So the best way that I found is really with the XLV, but there's other lasers that are out there. VBeam, if you're a certain Fitzpatrick, like Fitzpatrick 1 through 3 is really good. DermaV, some people say that's good too. But I like XLV. It's got great contact cooling, so I use it directly at some of those PIE marks, those little red vessels that are on the skin. And sometimes the little red vessels make the scars look worse. So, it's really, really nice to improve that. You can always try like azelaic acid could help a bit. It may not be really enough for the vast majority of patients, but it's something worth giving a shot. You'll do 10% azelaic acid and see if that'll help out with your PIE, the red marks. Juliano is asking why I don't open a clinic in Toronto. I actually have a lot of patients from Toronto, a lot of patients from the suburbs of Toronto. Just a couple of days ago, I had somebody from Scarborough, I believe. So I appreciate everybody from Toronto. Thank you guys. But at this point, not something I'm interested in because I really have to just focus on just my space over here is like just really, really busy. And I have to just make sure that like our team and our staff is just available for doing all these everything for follow-ups. And I don't know if I could do that in multiple different locations. In fact, I'm not even sure how people could do it like this kind of level in multiple different locations. It's really difficult to kind of see that. I think maybe like one spot or something like that, again, like somewhere else, but multiple cities, things like that. Really tough to be able to see. We really want to make sure that we have a dedicated team that's always looking at your photos, looking at the progress, making sure that everything's very safe for you throughout the whole journey. like even beforehand. And so it's not really easy to do that somewhere else. That's how I could tell you that. And that's why it has to be like stuff, that's why I talk so much about this and I focus a lot about it, because I really did find that in order to do really almost anything at a very high level, you have to focus on it. And it's sort of interesting. I think that people can see that there's places that do a bunch of things, a lot of things, and nothing is great really. But if you could focus on certain things that you could do very, very well, you could be elite at it. And it's like goes for anything, for like everybody in the world, really. I think really, there's no real true genius in my mind. Everybody just needs like the opportunity to focus on something, and whatever that is, I'm not sure. What you could decide, whatever it is for you, and like and physicians out there could decide whatever it is for them. But like focus on it and do it like exceptionally well. I don't mean that that's like the only thing you do. I do a few other things, but in order to do things that are very, very high level, you have to do a lot of it. You have to really pay attention to it. You have to have a full team, in this case for our kind of work, who's also dedicated to doing those type of things and supporting it. So it's not something to just kind of do really casually. I know there's some people actually who reached out to me that they are interested in just adding certain treatments, but they have so many different treatments out there. There's so many things that they're doing, and it's a little bit tough for me to visualize how they're going to do this type of procedure, at a high enough level. I'm not sure. It doesn't seem possible unless you really, really want to dedicate yourself to it. Would lasering blood vessels on my face worsen PIE? Well, it depends on what kind of laser it is, but if it's really true PIE, then probably something like the 532 or 595 wavelength would be really, really great for that. So that's probably a good option there for that. What would you recommend for mild acne scars? Easiest thing to do is really just start with a bit of tretinoin. Just start with tretinoin and see if that's going to help. That oil production is going to potentially help shrink some of your scars just on its own. And sometimes there's a bit of a collagen response that should improve or soften up those scars. So easy thing to do, starting some sort of retinoid really. Would you recommend chemical peels for scars? Really, it depends. If there's more like hyperpigmentation, then certainly we could do more of peels that solve pigmentation, improve pigmentation. But if it really is like deeper scars, then of those options, I would say really the best option is going to be like the phenol peel for a phenol chemical peel. Other than that, I wouldn't really recommend most peels for scars. I think it's going to be pretty mild, pretty superficial for the vast majority of patients. Thank you guys. Thanks so much for the nice remarks on here. I see some patients on here too. Thank you guys. Fucking Gam is saying, is your erbium laser similar to the laser used in a Fraxel dual? No, it's a little bit different. It's a different wavelength. It doesn't have as much heat or energy with the erbium laser. So that's what's nice actually. And basically, the thing with Fraxel dual is that there is more with heat. There's a bit of coagulation with the tissue, so that could be a little bit riskier in darker skin types. I recommend beef tallow? Not at this time. I don't have enough data to recommend it. I can't say. I've been too scared to try it myself. So at some point maybe I'll give it a shot. I always say that, but I don't know. A lot of people will say that it didn't work. Some people on here will say it did work. There are some people that I saw that on my For You page on these things that says that beef tallow solved their problems in like a week, which is really hard for me to envision. Like I don't know how that's working. And then it always turns out that they have some affiliate links for you to click and or they have like TikTok shop or something like that for you to click or something like that. And it's like full of beef tallow. So I don't know. Let's see here. Where was I at? Why do I not know about beef tallow if I'm not sure? I just say I'm not sure about something. I don't know. How would I know about like beef tallow? There's no studies about beef tallow. You will have to tell me if beef tallow works. It's not like something that is like, we have evidence of that showcases that beef tallow works anywhere. So it's something that just went viral just like a couple months ago. So I don't know. Like some people on here say that it works. Some people say it doesn't work. If you tell me it works, sure, I'll pay attention to it, and like we'll put that in like the back burner and like a few other people that say it. But there's no like studies that beef tallow people have like showcased that it works for acne or for scars. Certainly nothing like that's out there. So that's why I don't know. How could I know? It's like if I don't know something, I don't know. Like if you find somebody who knows every single thing about everything, I think that's kind of like questionable too, because it's like, I'm fine with just saying I don't know about certain things. I'll take a look at it. But beef tallow is something that, like, how am I going to really know about that at this point, other than just word of mouth, people trying it, things like that. And it's tough for me to really gauge if it really is real or not. It's like there's no studies, no evidence really whatsoever that it works. Just some anecdotal people that say it. Sure, okay, cool. Anecdotal evidence doesn't mean that it's not true, but, like, it's not also like scientific enough for me to give my recommendation for. Does Accutane heal acne scars? Good question. I think it's possible that for certain kinds of scars, it's going to trigger enough of a collagen response that it may actually soften up some of those scars. It may lift a bit of those. And then the other thing is that sometimes with like certain ice pick scars, it reduces the diameter of those scars, which is nice. So it can actually shrink some of those scars a bit there. So Accutane does help for some of those scars. And you may see, if you're on Accutane, that even some of your post-inflammatory erythema marks, those actually improve a bit as well too. So it's nice that there's a few different side effects that are beneficial with reducing your oil production, managing your acne, all those that actually do help stimulate enough collagen that maybe your scars soften up a bit. And that's why I'm a real big stickler about controlling your oil production, controlling your acne, and it's really so that we can maximize your collagen response. That's the whole point. I've had acne for 2 years. I will try beef tallow this week. I will be back and I will let you know. Thank you so much, Ambu. Appreciate it. Let me know. How long should someone take it minimum? And I guess you're referring to Accutane. It depends. Usually there's a certain threshold that we're trying to achieve with the dose. It depends on your weight. And if we're doing lower dose, usually like 0.2 kilograms per milligram. It's kind of on average or so for like a lower dose, but it depends on like how severe your acne is and what time frame you could do it for. Let's see here. Something, I guess I'll miss that, but something making scars worse. I'm not sure what that was referring to. Fate Trust is saying, does red light therapy really work? If so, are there any that you recommend? Well, it will help a little bit with inflammation, a little bit with collagen production, but it's certainly not something that I recommend for scar patients. It's not really going to improve anything for these scars. So I wouldn't really say it's going to improve that. And it's not something that I use in my practice because of that. Amani saying, what is your favorite procedure for pitted acne scars for deeper skin tones? So it could be, if you're talking about like really pitted, usually someone like that, I'm usually thinking probably deep ice pick scars. Correct me if I'm wrong, but I'm thinking deep ice pick scars. Those like excisions actually work very, very well depending on the location of the scar. So if it's more lateral, it's a really good spot to probably just take that out. Also TCA Cross, really, really good options in that skin type. If we need to, if there's like a whole cluster of those scars, we may have to do some subcision, and then we may have to do a little bit of volume underneath there, because a lot of times those deeper scars do destroy fat. So you want to do something to support that. Hey doc, what is your thoughts on treating melasma for dark complexion? I have so many melasma results. We'll showcase some more this week, I think, but we have a lot of melasma results. I do so much melasma. The biggest things I found, of course, is sunblock, huge. Telling people to quit smoking, another thing actually. You'll be surprised of the link with smoking and scars, smoking and melasma. And on top of it, of course, we want to make sure that we do things to inhibit the melanocytes. So that way we actually could make sure, and whatever treatments we're doing, they're not going to cause rebound hyperpigmentation. So sometimes like topical hydroquinone or some sort of compound that's going to actually suppress that. You could do oral tranexamic acid. That actually helps. I think it's better than topical tranexamic acid. And then we also do is the pico laser. All that actually helps out a lot actually with melasma. So consider those options. Hazel saying, I'm a teenager. Should I try a skincare or should I go with Accutane? Well, it depends on how severe your scars are. It's tough for me to say unless I know that you have very severe scars or mild or moderate to severe scars, or I should say acne. If you have moderate to severe acne, then you really should take it very seriously, take it aggressively, not necessarily jumping to Accutane per se, but make sure that you are doing things like topical antibiotics, dapsone, potentially with clindamycin, oral antibiotics as well. If you need to, just really do things to prevent scarring. If there's a lot of oil production, then yeah, absolutely, you should consider doing Accutane. We also do the Accure laser. Accure laser works just like Accutane in normalizing oil glands. So either option could be okay, but really take it very seriously. As soon as you have moderate to severe acne in particular, you really want to make sure that you're on top of that and controlling that. Kim MD, good seeing you on, by the way. Should I reduce smoking and eat more collagen during this process? Yes, you should. You should absolutely reduce smoking, eat more collagen. Questionable, but I mean, definitely quit smoking. If you want to try collagen, sure. I think things that could help though would be things like omega-3s, zinc, all that could actually help you out there. So I would consider that actually more than just like, adding collagen. Also, cut back dairy. Cut back dairy intake, just should actually help you with their oil production as well. A lot of people will find that their dairy intake actually does increase their oil production, does increase their acne, so cut that out. LD is saying, I wish I could have this. Hopefully one day I can help you. I know that it seems out of reach for a lot of people. My prices are on there, and most patients spend about $5,000 to $7,000 on their scars. I understand that that's a lot of money for people. I could tell you though, whenever we're able to do this, I will take it very seriously. I will make it worth your while. I've had patients who spent, $8,000 on Clear and Brilliant packages, on traditional microneedling pen packages, things like that. And it's unfortunate, so at least if you're coming to me, we're going to do it properly. So we'll do it the right way. We'll do it like the best possible way to maximize your results. So at least that's a good feeling, and I could feel like that every single night, every single day I could do that I do this. I feel like at least I could do this at a very, very high level. And even though I understand it's a lot of money, I'm going to take it very seriously, and I know that you took a lot of effort to come all the way out here. Most of our patients come from out of state. So it's like, take it like this needs to be done very, very well and done very well over and over and over again. It's super important to me that's done that way. Lucky Singh is saying, hi, Dr. Qazi. What are the chances of scars returning after treatment? Has this ever happened with your patients? And what are the chances of skin sagging after treatment? Thank you. Well, I appreciate the thank you. Okay, number one, what are the chances of scars returning after treatment? Low likelihood if your acne is under control. Very low likelihood. And I'm not saying that's impossible, because the reason why it's not, that it is still possible for you to still see some scarring after your skin looks great, is because sometimes you may have some fat loss as you get a little bit older, and it may reveal some depression and some scarring, and that may be fixed with some volume, but it's important just to pay attention to that it's possible that you may still find that as you get a little bit older, some fat was supporting some scar tissue, and now it looks like you have some volume loss there, and you look like you see some scars right there now. So that part may occur. But with the texture, that you get to keep. As long as you don't have new acne, your oil is about well controlled, your texture you get to keep. It's awesome. And you were asking about the chances of skin sagging after treatment. So skin, like for example, for this patient, it was sagging due to his acne, due to his scars. It's essentially what ended up happening is the acne, when the scars created this these huge craters, and in those craters there's this tethered bond that was pulling down his skin. And as he was smiling and animating and shifting his weight, shifting his head, it was stretching out that skin. And over the years, this patient was in his 40s. Over the years, it kept on stretching out the skin, and then he had laxity from that. So just having the acne, just having those scars ended up causing laxity. And so it was important just to pay attention to that. Just by itself, it caused laxity. So actually doing these treatments, the patient I had today, I worked on her subcision. She felt that actually it improved the contour of her face, as she felt like it lifted up her face as well, doing subcision. And that's because I improved some of that issue where it was this indentation, and she was smiling around that indentation, and it was causing some laxity due to that. That being said, there are cases. I have actually had patients who have done subcision elsewhere, and there's somebody who does it, and they use their own tool that they claim that they invented or so. I'm not saying it's not Dr. Taylor at all, just so you know, nothing like that. But it's something that they claim that they've made, and they do it in the lower part of the face. And it's potentially very risky the way they're doing it, because I've seen now multiple patients who have had sagging from this. That's very clear sagging. Actually, somebody on the live the other night said that was me, that you helped improve. I already worked on her, one of the patients, and improved it. I fixed it, actually. But there's some cases where it's so severe that you may end up needing just a facelift, actually, to fix that. So when it comes to the lower part of the face, I don't use those kind of tools in that kind of wide sweeping motion. And that's how I could avoid that. I'm very, very precise. Anybody who does subcision, I know I did multiple subcisions today. The patients that did subcision today all could tell you if they're on. I don't know if they're just recovering today, but they all tell you that it's super precise the way I'm doing it. And even if they did subcision before, even if they've seen subcision videos, and it doesn't matter. It's very, very different the way I do it. It's very focused on the areas that we need to treat. It's not like this wide sweeping motion. It's just very precise. And I'm constantly testing and feeling the skin as I'm working through it. So that's how I could avoid those issues with sagging or any other complications that could happen. Should I stop using fake tan before my treatment? Yeah, you want to make sure that your skin is your natural skin type. So yes, that is correct. You want to stop that. Do you recommend the omega-3? I've been taking zinc before and it broke me out bad, open to taking. Omega-3 is awesome. Yes, I may have missed it. I was talking about that earlier. Someone was asking about the ways that you could use some supplements, and omega-3 is an excellent supplement to consider taking. Anuj is saying, would subcision the same result as incision can be achieved? I think you're asking, is a subcision the same result as excision? Not necessarily, no. So excision is basically for maybe like a wide boxcar scar. That's a wide, deep boxcar scar. You may just want to take out that scar. Little ice pick scars, you may just be able to take out those scars depending on the location. And that's a different process completely than subcision, which tends to be more for boxcar scars that are a bit pulled down, or rolling scars. So it's very, very different. Does subcision hurt? No. I mean, none of my patients today, none of them hurt. I do a ton of numbing, so it doesn't hurt actually that way. Do you ever need to stay overnight after a procedure just for the phenol peel? That's the only time you have to stay overnight. Can you use pigment control cream and different at the same time? The pigment control cream has retinoid. Yeah, so you do not use different. That's going to be too harsh, too irritating so much. Good seeing you on, by the way. Looks like you're not doing any lessons tonight, huh? No teaching tonight? Let's see here. How do you avoid hitting nerves when you're doing subcision? It's all about being in the right plane and ensuring that as we're doing that, even in the right plane, we're not using as much force or much force really. So really carefully, meticulously breaking up some of those scars. But sometimes there's really thick scars, and there are going to be some nerves that are a bit, that are basically wrapped around some of that fibrotic tissue, and some of those may end up getting sliced a bit, and that's okay because you have collateral nerves. There's a bunch of collateral nerves, so I've never had anybody with permanent numbness. It may be for a few weeks, a few months even, that you may actually get that if you have very thick scars. It's possible. The thing is, though, you have so many different collateral nerves. Usually, though, what it just gets dinged for a bit. It just gets just numb for a bit. And just, after a few weeks, you kind of massage that and wake it up, and it wakes up. But, I can't comment on other people if they're doing too deep, potentially. Sometimes I see people that they are going really, really deep as they're doing some of the subcision work, and that could be a concern then, the way they do it sometimes. So it just depends on the depth, really. Let's see. So what kind of numbing do I do for subcision? So basically it's a mixture of lidocaine with epinephrine and some bicarb so it doesn't burn, and a lot of saline. So a lot of that basically is how we do the subcision, and that's how we can actually stretch out the skin a bit, and then we can glide underneath there and actually break it up really well. I appreciate you, Mrs. Jones. Thank you so much. And thank you guys.